The director of the World Health Organization recently said something very striking. He declared the end of the COVID-19 pandemic is in sight. How long have we waited to hear that? But with hundreds still dying in the U.S. every day and thousands in the hospital, what exactly does that mean? To address that very question and questions about monkeypox and the flu season, we're joined by someone at the table who knows all the answers to that, Dr. David Agus. Good morning. Is it too early to breathe a collective sigh of relief? Because when I heard it, I did finally. What do you say?
Yeah, 2.5 years, over 17 million people died of this pesky virus. So I do think we are at the end of the pandemic, but we're not over COVID-19. So I do think COVID-19 is going to continue, but it's not going to be a pandemic that shuts things down. We're going to live with the virus.
People will still get it.
We're not going to hide from it. People are still going to get it on a regular cadence, but we're going to get those boosters. It's not going to be serious. And if you have, other medical issues, you'll get Paxlovid or the antibodies. We're going to live with it and prevent hospitalizations. It's the lowest death rate on the globe since March of 2020.
And you say get the booster, the new booster that's coming out.
I say yes, definitely get that booster. Several million people have gotten it. It's proven safe in those people. Please get that booster, broader immunity.
Can you mix the boosters if you've been a Pfizer girl or a Moderna girl? Can you mix them?
When you mix, the first time you mix, you get a bump in immunity. So I got all Pfizer. This time I got Moderna because I wanted that bump with this new booster. So yes, you can mix. You look like a mixer.
Yeah, well, I'm going to mix, yes.
It could be a mixer and a same day, or meaning booster plus flu shot.
Yeah, it's more side effects, but certainly the flu shot is important this year. It was bad in Australia, and for 2 years, 40 million people normally get it a year. They didn't, so we have less immunity to the flu. So this year especially, get the booster. Kids under 9 who haven't had a flu shot yet or only one in their lifetime actually need to get 2 this year, spaced 4 weeks apart.
I don't understand your thinking on getting them both at the same time, David, because if you have a reaction, you're not going to know where the reaction is coming from. Shouldn't you know where the reaction is coming from, or does it not matter?
A lot of people say, listen, convenience-wise, I got to work. It's really hard for me to get in for anything, and those people should get it. I think you should separate if you can, because there's fewer side effects. Better, separate each one by a week, which is what I'm doing, and my patients I'm recommending. But some people just schedule-wise can't do it, and if you can't, medically, it's okay.
For those that are wondering, are we on the other side of the pandemic right now?
Yeah, I think we are in this country. I mean, we walked through the streets of New York. I saw 1 mask out of 100 people. And so I do think we're out of it. At the same time, we're not over COVID-19, which is really the message here. We're going to have to get used to it. And we're going to have to get used to testing when we feel sick and staying home. But this is our regular cadence for the next couple of years.
I'm still going to wear a mask on the plane. I'm flying to London. I know they say it's safe, but it's still... The flight attendant doesn't wear it, the pilot doesn't wear it, but I'm still going to wear a mask.
Are you going on vacation in London?
Yeah, right.
What's going on in London?
No, I'll be working. What about monkeypox?
So monkeypox, significant decline in cases, but it's still there. It's still in this population of individuals, gay men predominantly. We need to get more vaccines to them, and if they do get it, we need to treat them because we have treatments that work. So monkeypox, unfortunately, it spread like wildfire, but now it's getting under control.
All right.
Dr. David Agus, thank you so much. We appreciate you.
We said he'd have all the answers.
That's
Look
right.
at you.